Hello and welcome to Pregnancy Info. Today we are going to discuss that what are the causes of dryness in vagina. Vaginal dryness is very common. Around 17% of women aged 18 to 50 and more than half of postmenopausal women over the age of 51 experience vaginal dryness. Lower estrogen is a common trigger of vaginal dryness, and menopause, pregnancy, birth and breastfeeding can all impact estrogen levels, but there are other causes too, including autoimmune diseases, certain lifestyle choices, and medical or surgical treatments. What's vaginal lubrication and why do we need it? Vaginal secretion is created by glands in the cervix to maintain a moist, slightly acidic environment in the vagina. The secretion helps maintain the right balance of bacteria and prevents infection by flushing out dead cells and unwanted bacteria to clean the vagina. The secretion changes throughout the menstrual cycle to help or prevent the movement of sperm and to protect the body and a potential pregnancy from infections. The lubrication you experience when you are sexually aroused is different. It's activated in the Bartholin's glands right by the vaginal opening. This gland produces secretion all the time, but it also activated when you are sexually aroused to protect the sensitive membrane in the vagina during penetration. What are the symptoms of vaginal dryness? The most common vaginal dryness symptoms include vaginal discomfort, tenderness, and pain. Pain during penetration, itching in and around the vagina. Reduced moisture in the vagina can also upset the balance of vaginal flora. The bacteria living inside the vagina, which can increase the risk of issues like urinary tract infections, vaginitis, and bacterial vaginosis. What causes vaginal dryness? Vaginal dryness has a range of causes, but it's often linked to the production of hormones like estrogen and progesterone. The best treatment for dryness depends on what causes it, with several different causes. Number 1. Perimenopause and menopause. During perimenopause and menopause, the body produces less estrogen. This can cause the mucous membranes in the vagina, which are usually moist, elastic, and pink, to become increasingly dry and pale. Vaginal dryness during menopause is also called vaginal atrophy. It affects more than 50% of all postmenopausal women. This can cause stinging and itchiness as well as pain during sex. It can also affect the urinary tract, making you pee more often or leading to recurrent UTIs. You might notice vaginal dryness alongside symptoms like irregular bleeding, hot flashes, or changes in libido. Number 2. Childbirth, breastfeeding, and the early postpartum stage. This isn't a cause for concern. It's perfectly natural and will pass. You might also experience missed periods or periods that haven't returned as a result of hormones preventing ovulation. Using a water-based lubricant can be a good idea, and if that's not enough, a doctor may prescribe local estrogen to use temporarily. Number 3. Hormonal contraceptions. Vaginal dryness is a common side effect of hormonal contraceptions. This is because the body's production of estrogen and progesterone, which control the production of vaginal secretion, is replaced by the synthetic hormones in the hormonal contraception. Number 4. Antidepressants. The primary role of SSRIs, a widely used type of antidepressant, is to increase our levels of serotonin, a key hormone that stabilizes our mood. But antidepressants also impact receptors for a neurotransmitter called acetylcholine. This blocks certain involuntary muscle movements and bodily functions, which can lead to vaginal dryness. Number 5. Hysterectomy. Both the cervix and the cells that produce vaginal secretions are often removed during a hysterectomy, and this can cause vaginal dryness. If you experience these symptoms after having a hysterectomy, talk to a doctor. Local estrogen can help tremendously. Number 6. Chemotherapy. Additional symptoms: menopause triggered by medicines, also known as iatrogenic menopause or medical menopause. Chemotherapy often affects the hormone production of the ovaries. This puts the body in a state of chemical menopause. Number 7. Overwashing. Some people think that it's necessary to flush out the vagina with water, but water has a dehydrating effect. The vagina is very clever and cleans itself. That's exactly the purpose of the secretions and discharge. It is completely normal as long as it's not accompanied by pain, discomfort, or foul smell. Number 8. Sjogren's syndrome. Sjogren's syndrome is an autoimmune disease that causes chronic inflammation of the body's secretions producing glands, which leads to less secretion production. It can cause a dry mouth, eyes, skins, and a dry cough. As a result, it can also cause you to have a dry, itchy vagina. Number 9. Diabetes. High blood sugar levels can cause damage to the body, small nerves and blood vessels. This can affect the glands in the cervix, resulting in dry mucous membranes. Other symptoms of diabetes include increased thirst and needing to pee more often, lack of energy, and blurred vision. Number 10. Not feeling aroused during sex. Sometimes people experience dryness when they are simply not aroused. Use a water-based lubricant to try more foreplay or other alternatives to penetration. It's also important to explore why you may not be feeling aroused to avoid developing chronic vaginal pain. Number 11. Antihistamines. Antihistamines block your body's histamine secretions to help relieve a runny nose or watery, itchy eyes. This can affect the mucous membrane of the vagina, making it drier than normal. When should I speak to a doctor about vaginal dryness? If you are struggling with any of these symptoms and there is an obvious temporary cause like breastfeeding, speak to a doctor. Advice: never ignore these symptoms. Pain during sex that doesn't go away with increased arousal, recurring UTIs, recurring thrush or bacterial vaginosis, vaginal bleeding that's unusual and abnormal for you. So, share this video with the female who are suffering with this problem and don't know how to treat with this and what are the causes. And must share your opinion. How do you find this video in the comment section. Take care. Bye-bye.